But we have already had some new figures in the last hour from the Office of National Statistics. This is the data looking at the number of deaths in total in the UK. There is a slight time lag to assemble the reporting, but let's get the main points now from our economics editor, Ed Conway. Morning, Ed.
Morning. Yeah, we have been looking at these numbers. They are from the Office for National Statistics for excess deaths. You'll remember each day we get numbers from the government, and they have started to include numbers of people who have died outside of hospital more recently. But these really are the most definitive measure of how many people have died of COVID-19 and indeed from all causes in England and Wales. These numbers are from England and Wales, I should say, but there are numbers for Scotland and for Northern Ireland saying more or less the same thing. And there was some speculation as to whether the number of total deaths, people talk about excess deaths, it's a kind of statistical term basically, talking about how many people are dying in a given week compared with the average over the course of the previous 5 years. And it gives you a sense, you know, if you're trying to adjust for whether all of the COVID-19 deaths have been properly diagnosed, well, some people would rather just look at the total number of deaths above the seasonal average. And some people thought that there might be a chance that it might continue to increase. But the good news actually is that it does look like excess deaths have peaked. They were up above 22,000 in the previous week. So we're talking about week 16 was the previous week. That was the week that started with Easter Monday. And now we have to for week 17, which is the week ending the 24th of April. And it was 21,997 people in total who died from all causes in England and Wales during that week. That's down by 354 compared with the previous week. And as I say, there will be some relief, even though that number is very high. It is far higher than anyone would like to see. It's actually pretty much double what you would normally expect at this time of year. There'll be some relief that it is now starting to fall, that we have those comprehensive figures from the ONS, and they're suggesting the numbers are falling. And here's the thing that's worth just, I think, bearing in mind, Adam. You know, a lot of people have looked at this disease and they've said that in many ways it is worse. It has a higher potential fatality rate than many diseases, probably any epidemic that the UK has faced since the Spanish influenza at the start, just over a century ago. Well, what we now know is the number of people who have died of this is below, as a percentage of the population, is below what we saw in the worst weeks of the Hong Kong flu, which is the flu that happened towards the late 60s. So we are actually coming in below that level if you're looking at total number of excess deaths, below the levels we saw in the first week of 1970. So there will be some, I think, relief that we managed to not, you know, that we haven't seen numbers coming in above what they were in that disease. And many people in the government, you saw Sir Patrick Vallance a moment ago, will say that is due to the lockdown measures that have been imposed. As I say, though, some reassurance that the numbers seem to have peaked, although it's worth pointing out that while they certainly have peaked in hospitals and they're coming down, what these numbers show is that the number of deaths in care homes is still rising, and the number of deaths in private homes is still rising. So there is a bit of a divergence there, but the overall numbers of total excess deaths now starting to fall, and this will be taken as some form of slight reassurance that indeed we are now well past the peak.
Ed Conway, thank you very much indeed for that.